Our improvement approach is as simple as ABC. Every change undertaken at Pennine Care should be underpinned by our ABC improvement model, so all projects should be clear about what their aim is, what the benefits are and how they'll be measured, and what changes are necessary to achieve the aim and benefits. So let's look at each of those elements in turn. First, the aim. Any improvement or change should have a clear and concise aim. This is a short sentence that describes what the purpose of the change is. It is often best to begin an aim statement to improve, as this will help us focus on the right aim. For example, if we have an issue with patients not attending an outpatient clinic and we plan to introduce text reminders, we may wonder which of the following statements would be the correct aim. To reduce patient did not attend or DNA rates, to introduce a text reminder service, to improve attendance at the outpatient clinic. The best aim would be the last one, as the purpose of our project is to improve attendance. Although we will want to reduce DNA rates, this is much better described as one of our benefits, something we'll discuss next. Finally, introducing the reminder service is one of the changes we will make. Additionally, our aim should state what patient population, service or area it applies to. For example, for patients over 65, or in the community mental health teams, or so on. Although it is not required, if there is a specific time frame or target we need to achieve, we can include this as well. Our final aim might therefore be to improve attendance at Bury Community Mental Health Team outpatient clinics by December. Next, the benefits and the measures. A benefit is a positive outcome of change as perceived by our stakeholders. They are the reasons for making the change. Ideally, a project should have 3 to 4 key benefits. It is important to ensure that all our benefits are measurable, as it will be difficult, if not impossible, to demonstrate we've achieved those benefits if we cannot provide the necessary quantitative or qualitative evidence. When thinking of your benefits, it is often helpful to imagine yourself in the future with the work successfully completed and consider what the impact has been. For example, in our improving attendance project, the benefits might be reduced patient DNA rate, decrease in waiting lists, clinician time better utilised, decreased patient complaints. Now, we need to ensure these are measurable, so let's check. Yes, we can compare the DNA rate before and after the change. Yes, we can measure both the number of patients and their average length of wait. Yes, we can look at appointment times and DNA rate to find time and cost savings. And yes, we can see how many complaints were received. All these benefits are measurable. As you may be able to tell, it is important to ensure that we collect any necessary data before we start our project if we plan to compare against it later. There may also be other measures that are not linked to the benefits, but that are useful to collect to ensure we are making progress. These might be number of staff trained on the new text reminder service, or the number of patients whose contact details have been checked. Perhaps you can think of some others. Lastly, other changes. These are all the actions and steps that are needed to ensure the aim and benefits are realised. These will be the essential changes that we will need to implement or test out. In our attendance example, our changes might include introduce a text reminder system for appointments, train staff on the new system, amend the clerical workflow to include new processes, including proactively rebooking cancelled slots, check and update patient telephone numbers, communicate with patients and collect feedback about the new changes. Maybe you noticed that some of these changes included things we can measure. This is what we discussed before. If we notice any of the changes lead to additional measures, then we should also try to ensure these are recorded and monitored as well, as they'll provide further evidence of our success and that our project is on track. So, to summarise, as we have seen, the ABC approach to improvement is simple and straightforward, and should support everyone in making meaningful changes, whose impact can be demonstrated. The Strategic Delivery Hub has developed a single-page ABC poster template that can be used for writing up completed pieces of work. This also contains guidance on the ABCs, as well as how to consider your initial issues, the final outcomes, and any next steps or recommendations that may be needed. You can also contact the improvement leads in the Strategic Delivery Hub for further support and guidance. So don't forget, when you're undertaking improvement, remember your ABCs.